intercounty transfers. Senator Monning, we have support on both sides.
Great, thank you, and I will respect that, Mr. Chair and members. Senate Bill 1339 modernizes and simplifies the intercounty transfer process and state statute to make sure that benefits are not interrupted when a beneficiary of the CalWORKS, CalFresh, or Medi-Cal program relocates. Specifically, this bill would allow either a sending or receiving county to initiate an intercounty transfer when made aware of a beneficiary's move. It would clarify that a face-to-face interview is not required to transfer. It would allow the beneficiary to report the change online to the extent the technology is available, and it would clarify the intercounty transfer process and access to services for Medi-Cal beneficiaries. There's been some confusion among counties with regard to the implementation of intercounty transfers, and there are instances in which the sending or receiving county does not fully understand the process due to the current law being vague. Mr. Chair, I'm going to stop there. I do have a couple of witnesses. I do want to acknowledge we'll have Elizabeth Landsberg from the Western Center on Law and Poverty. I have two students from McGeorge Law School. One will be giving testimony. Those students are Lauren No and Brittany Barsati. There's been a group of McGeorge Law students who have been doing a part of an independent study, volunteering, researching on this bill, supporting this bill. So I just want to thank McGeorge Law School for providing these wonderful students to help us move the policy process forward. We'll have some other witnesses in support too. They will be brief. Thank you, Mr. Chair.
Mr. Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty, and we're pleased to be one of the co-sponsors of the bill. Recognizing there is support on both sides, we just want to thank Senator Monning. This is an important bill to streamline the process. Medi-Cal is a statewide program, and your benefits shouldn't be interrupted when you move counties. Thank you.
Good afternoon, Mr. Chair and committee members. My name is Lauren No, and I am here today on behalf of the McGeorge Legislative and Public Policy Clinic to express our strong support for SB 1339. SB 1339 helps to ensure that Californians who have already been deemed eligible to receive Medi-Cal benefits continue to have access to those benefits when they move from one county to another. Our research indicates that many Medi-Cal beneficiaries lose access to services in some instances for months at a time simply because they move across county lines. For those suffering from chronic disease or battling mental illnesses, this can mean the difference between a quality life and undue and preventable suffering. Our conversations with members of the community are illustrative. A Medi-Cal beneficiary who moved from Santa Clara County to Alameda County suffering from bipolar disorder experienced a delay of several months before his intercounty transfer could be completed. During this time, he was forced to commute back to Santa Clara County to receive routine care and access to prescriptions. On 2 occasions, this individual resorted to emergency rooms when he fell off of his medications. Another Medi-Cal beneficiary moved from Santa Clara County to Alameda County and attempted to proactively initiate the transfer before her move. However, she was advised that she needed to wait until the move was complete and that she could provide proof of address in the new county. The individual stated that she was given up to 6 telephone numbers, placed on hold for up to 4 times for 4 hours, and was given a complete runaround. She explained that the sending county, although it wanted to help her, expressed to her that their hands were tied until the sending county initiated the transfer. Ultimately, she disenrolled from her plan in the sending county altogether to reapply in the new county. Many Medi-Cal beneficiaries are living on a limited income and are already struggling just to get by. They should not have to lose access to Medi-Cal services just because they move from one county to another. And for these reasons, we respectfully request your aye vote.
Thank you. Anyone else? Support?
Good afternoon. My name is Brittany Barsati, and I am also here on behalf of the McGeorge Legislative and Public Policy Clinic to express our support for Senate Bill 1339. As the Senator mentioned, we've been researching this topic for several months now, and during that time, we've spoken to expert eligibility workers at Department of Healthcare Services, county eligibility workers who deal with this issue, and many of the stories that Lauren mentioned of people who have been affected by this issue. I would just like to clarify that when counties are dealing with someone who's trying to go through this transfer process and they need access to care, they have been referred to emergency rooms for their services. And in 2013, there were over 5.1 million Medi-Cal visits to emergency rooms, and many of those were for non-emergency issues. By streamlining this transfer process, we can hope to decrease those visits to emergency rooms, which are costing our state dollars that could be better spent elsewhere. SB 1339 is a necessary first step in bridging the gap in access to care while counties go through the necessary process to complete a transfer. And for those reasons, we respectfully request your aye vote.
Good afternoon. Judy Darnell with United Ways of California, proud co-sponsor of this bill, and we represent 33 local United Ways across the state who have seen this problem in action, and people move for a lot of reasons, so we request your aye vote.
Yeah, good afternoon. Kevin Anthony, Coalition California Welfare Rights Organization. These inter-county transfer laws come from the previous century, and there's a whole bunch of technology. People have iPhones and all kinds of other technology, and what we want to do is bring this statute up to the 21st century. We urge an aye vote. Thank you.
Thank you. Anyone else support?
Kelly Brooks on behalf of the County Welfare Directors Association. Very pleased to be here today in support.
Thank you.
Vanessa Hina on behalf of the Nurse Family Partnership here in strong support.
Thank you.
Tam Ma with Health Access and Support.
Mike Montgomery, Congress of California Seniors. We support the bill.
Thank you. Opposition? Questions, comments? Nate, would you like to close?
Respectfully ask for your aye vote. Thank you for your indulgence, Mr. Chair.
Thank you.
Appreciate it.
SB 1339, item number 11, do pass as amended to appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, aye. Hall. Mitchell. Monning.
Aye.
Monning, aye. Nielsen. Pan. Pan, aye. Roth. Wolk.
That is four.
Mr. Chair,
Yes.
on a technicality, was there a motion on that?
I thought somebody did, but motion.
I wasn't aware of it. I just want to make sure we're technically.
Moved by Senator Pan. Let's recall the vote. A motion by Senator Pan. Recall the members.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, aye. Hall. Mitchell. Monning. Monning, aye. Nielsen. Pan. Pan, aye. Roth. Wolk.
4-0. We'll place that bill on call.